Dr. Martin, and welcome back.
Thank you, Diana. It's a pleasure to be here with you.
You and I talk offline sometimes because I, as an endo patient, have endless questions about this very perplexing disease known as endometriosis and all the comorbidities and symptoms and things that coincide with it. And one of the topics you and I were discussing was inflammation, endo and inflammation. Endo is known as an inflammatory disease. We hear it all the time within the community, but what does that actually break down to mean?
Well, endometriosis is like many other inflammatory diseases. That means that it has increased cellular and non-cellular inflammatory components. And those components have names like cytokines, interleukins, leukocytes, and more. We won't talk about the specific names today, but those components are designed to help control disease. But in endometriosis, they malfunction and can actually make endometriosis worse. That's not uncommon in the body. Those reactions are also found in other inflammatory diseases, which include arthritis, diabetes, heart disease, cancer, and depression. Even depression can have inflammatory components. Yeah. So it gives us an idea of what goes on, and it helps us have an idea of what we might do to try and control it currently and potentially to control it in the future.
So what are some signs before we go into potential treatments, different methods that you can do to kind of curb inflammation, but what are some signs that for someone who has endo could be having an inflammatory response?
Okay, so when you think of inflammation, one of the most basic things we can think of with inflammation is what happens if you have a pimple or a cut. It swells, it gets red, it's tender, and it can cause scarring. So when you look at that redness and tenderness, those are components that you see in pain, or components of pain. They can cause pain in women with endometriosis. So inflammation can cause direct pain. In addition, that scarring can cause nerve entrapment and increased pain, and the scarring can also cause a structure of endometriosis to enclose bleeding so that the bleeding tries to come out. It's almost like a pimple trying to pop.
Oof.
In addition, if you look at in addition to pain, if you look at infertility, that inflammation can decrease sperm transport, egg transport, and potentially implantation within the endometrium.
Right. So those are all signs of the body having an inflammatory response with endometriosis. Now, would endobelly or endobloat be considered an inflammatory response?
Certain parts of endobelly and endogloat are an inflammatory response, and others have to do with just the reaction to fermentable sugars that are poorly absorbed in the bowel. One of the basic things we can do is if someone does have endobelly is to try to decrease certain fermentable sugars that are poorly absorbed. Mm-hmm. And there's a diet that's named after those sugars, FODMAP. It has to do with some of the polysaccharides and fermentables that can help. Daily stress can also increase that inflammation so that things like relaxation therapy, meditation, and yoga can also be useful.
Mm-hmm. I had a OBGYN once tell me that endobelly was just an excess of gas.
Well, it's not that simple. I wish if I had a picture. I don't remember if I ever sent you that picture of somebody I had who had endobelly.
No.
And every time we would put her to sleep, her endobelly would go away. I mean, she'd be sitting there talking to us with this great big belly that looked like she was probably 6 months pregnant. And we'd put her asleep. All of a sudden, her belly would go back to normal. And I never understood that.
Wow.
That's not, gas doesn't do that. There's nothing conscious that I can think of that can do that. It's just some sort of reaction that I don't understand. It was an amazing thing. The last time we put her to sleep for anything, I actually took pictures of it right before and right after she went to sleep. And her belly goes from this to this almost instantaneously.
I bet she wants to know what the correlation is so she can use it in her daily life so she doesn't have to suffer with the 6 month pregnant looking endo belly. Because
Yeah, she thought that might be putting her to sleep all the time, but we didn't come to that conclusion that we could actually do
no,
that.
but that's a very interesting physiological response for sure. And I know we kind of went off a little bit on the beaten path about inflammation and endo. Um, but when we talk about how to deal with the inflammation, number one is stress, right? Because the more stressed you are in your lifestyle, the more the body is going to have that cortisol and increase and stress response, which is very negative overall when it's at a sustained pace.
Yes.
So, in theory, the idea that we can just all meditate and life isn't stressful and we could take things in our stride, that's a lot easier said than done.
Yes, it is.
So, how else, aside from finding their inner Zen, can people with endo deal with an inflammatory response?
Well, so in addition to, let's talk about the basic kind of things. Inner Zen is one of them. Meditation's
Yes.
another. More basic than that, though, is making sure you protect your sleep. If you don't get enough sleep, you don't fight inflammation.
Can you tell that to my 3-year-old? Because he does not listen.
I know sometimes controlling sleep is more than just making sure that you don't work 20 hours a day. Some people don't. Sometimes it's easy.
Mhm.
Things like making sure that you allot enough hours per day to sleep, which I didn't do until after I retired. I mean, I'd be up at 5 o'clock every morning going.
Yeah.
I now sleep till 7 or 8 routinely. But sometimes it's that easy. In addition to things like relaxation and your inner self, some things are easier than that, and that's just assuring that you have enough time for adequate sleep. Sleep isn't always easy, but when it's not, even adequate time is good, but sometimes sleep therapy is necessary. So if you're not sleeping well, consider getting help with that. In addition, is change your foods. Sometimes the foods you eat can interfere with sleep. Don't know if that FODMAP diet is going to help with sleep as much as it helps with endobelly, but it's worth trying.
Dr. Martin, what diet did you just mention?
The FODMAT, FODMAT, it's fermentable. It's the abbreviations in there. The F's easy. That's fermentable. Most of the rest of them have to do with what type polysaccharides are in there. It's one of those words that's taken from the first initials of several sugars, but it can actually help decrease the fermentable sugars that are absorbed poorly in the bowel of some women. But FODMAT.
Yeah.
You can Google it. There are a lot of different explanations of it on.
Do you have, I mean, you've treated so many patients over the course of your career. Have you noticed a link between diet and inflammation and endo?
Most of the things on dietary supplements and dietary care really were becoming obvious as I was retiring. So no, I did not notice that.
Mm-hmm.
But that wasn't anything that we looked for when I was still practicing.
Right. So going back to the methods of treating inflammation, do you think that it is maybe something that someone could do, of keeping like a food diary or some sort of journal about their daily routines to see, okay, when I eat this food, I have this response, and I've noticed this now over the course of 2 or 3 weeks.
That sounds like an easy thing to try.
Yeah. And then try to slowly cut out one thing at a time, whatever it could be, and kind of isolate what might be the trigger.
Yes.
Okay, so we have sleep, we have diet. Someone told me recently who just went, I think she had her second excision surgery, and she was given I think it was an anti-inflammatory drug, like it wasn't a muscle relaxant. It was an anti-inflammatory pill that she takes every single day because she suffers from bad sciatic leg pain. Have you heard that as a common
Yeah,
treatment?
there's several things she might be talking about. I don't know which one it is.
Yeah,
The most basic one is not the one she's on, but the most basic is just start with ibuprofen or acetaminophen.
yeah.
Cold, heat, do that also. Some of the medicines like she's talking about, there are 2 articles on the use of I'm trying to think of the medicine that we used for arthritis. There's some arthritis medicines that work that aren't
I
commonly
don't
used.
like to name check pharmaceuticals, but it wasn't Celebrex.
Celebrex is an ibuprofen-like medicine.
Yeah, I
It's a
think it's
cox.
something like that. She's on it. It was to help her sciatic leg pain that happens
Sure.
around her cycle.
Yeah.
And she was having great relief. And I've heard other people doing it with endo that they're getting some relief.
And the interesting thing about all those categories of medicines are that even though chemically they look alike, in an individual, they respond differently. There are women who, even though ibuprofen and I'm trying to think of the second one. So Aleve and
Motrin?
Motrin's ibuprofen.
Yeah.
The other one is there's a second one. I can't come up with it right now because I didn't use it that often, but it's almost identical to ibuprofen. But I had women who one would work and the other one would not. So 2 medicines, both of which looked alike, but you had different responses to them. So sometimes if one nonsteroidal doesn't work, you want to try another one.
Yeah. And I think that also goes back to kind of journaling what you do and what works and what doesn't work and give it enough of a shot. It's the same thing with like some people that have endo respond really well with hormonal suppressants. Some people that have endo don't respond well. I'm one of those people where I've tried an IUD, it just was not working for me. So I think with endo, it's one of those, like you throw it up against the wall as long as it doesn't have terrible side effects or consequences and you weigh the risk versus the reward and you just try to see what works for you. Because like you said, it's not a catch-all. What works for one person might not work for the next. In terms of inflammation and endo, do you think if there was a way to curb the inflammation that the endo itself would be less painful, or there's no way to make that link?
The direct effects of inflammation, we should be able to decrease the pain associated with those. So we should be able to control the direct pain associated with inflammation using medication and non-medical therapy. There are some indirect effects such as scarring, adhesions, and those sort of things that might not work on. So direct effects they should be able to do. The indirect effects we're not supposed to. The tangent to that is that if we control the direct effects early enough, then we may decrease scarring and the secondary effects, which increase the long-term pain and the need for long-term treatment, including both medical and surgical treatment of endometriosis. So if we go after pain early enough, we might be able to decrease the long-term effects. One of those ways of going after pain early enough is anyone with dysmenorrhea needs to be treated proactively as though they might have endometriosis. Whether they do or do not have endometriosis is not relevant at that point in time because it's the right thing to do for pain. So we want to treat that pain aggressively. And if as a secondary effect, we also decrease the chance they're going to develop symptomatic endometriosis later, that's all the better.
Right. No, I think it always goes back to early intervention because like you said, the inflammation can lead to the scarring leads to the adhesions lead to the mess that becomes in terms of either hurting fertility or fusing organs together or to different places they shouldn't be in the body, to then leading to having big surgeries.
Yes.
So like you said, the key here is if somebody is showing signs and symptoms that could be endometriosis, to nip it in the bud immediately and start treating it as such, even without necessarily a clinical diagnosis of it.
Yes, we have to treat pain as though it's serious and it's not normal, and we need to quit normalizing that pain in women.
Well, I'm glad that that conversation is happening now. I wish it happened when I was 11 years old,
Yeah.
because it would be a different trajectory. But it's very crucial. Like you said, early intervention is key, because once you get advanced in this disease, it's very hard. It's just a very hard treatment. And you're dealing with years and years of your body kind of being like this, I don't want to say a ticking time bomb, but sort of, until all the hormones settle. It's you just never know when you're going to have your good days, your bad days, your good years, your bad years. And hopefully, because of these conversations, we have the physician's ears, and they pay attention to people's pain, and it's not ignored, and that they can get the early intervention and treatment and the diagnosis that they need ahead of time. So Dr. Martin, thank you again, always, for your invaluable insight and knowledge.
Thank you, Diana. It's been a pleasure to be with you today.
And I will be writing you more questions, so you'll be coming back on very soon if you'll allow it.
I'll be glad to see you again.
Thanks, Dr. Martin.